Well, Dr. Kate Tulenko joins me now. She's founder and CEO of Corvus Health, a global health company. Kate, welcome to the program. Can you just run through what practical steps are they taking in these Chinese cities to try and contain the spread of this dangerous COVID variant?
So they're taking a number of proven measures to eliminate outbreaks. So, one is closing transportation in and out of the cities. The other is mass testing. For example, in Wuhan, they're going to be trying to test the majority of the 11 million people in the city. They're also shutting down non-essential services and doing a partial lockdown. And also, as you heard in that previous report, really trying to protect high-risk workers and make sure that they're not in close contact with their family while they're at high risk.
And Kate, how is it that people are alerted to come in for a test? Do they get a text on their phone? Is it television advertising? Are they written to in the mail? I mean, how do you tell 9 or 11 million people in the city to come back for a test?
China's a very wired country, so they can alert people all those different ways. But text is one of the main ways that they alert people, also through neighborhood committees as well. They're able to alert people, particularly older people who may not have a cell phone or may not be as tech savvy.
And is the Delta variant targeting the unvaccinated, like we're told it is in the USA? I mean, are there unvaccinated people in China despite everything that the country has been through in the last year?
Well, because China has done such a good job at, stemming the outbreaks with the strategy of lockdowns and mass testing, China has not vaccinated as many people as it could have. And that's what's allowed China to donate vaccines to other countries. So that's what we see. And now China is trying to put more of an emphasis on vaccinating its own citizens. And certainly we are seeing more people catch the Delta who are unvaccinated, but certainly vaccinated people as well can catch the Delta.
And do you think that this outbreak, and I'm talking about in China now, specifically in China, does this outbreak seem as serious to you as we're told it is here in America, and as it certainly was at this time last year, given the vaccine cover? Or is there a sense that what we're told today could be completely different by tomorrow?
Well, I think we need to put it in context. On one side in Wuhan, these are the first positive cases since May of 2020. So that's quite significant. But on the other hand, there have been around 328 cases in China in a population of 1.4 billion over about a month and a half. Whereas in Florida, which has a population of 21 million, they have about 17,000 positive cases a day. So that puts it in perspective. I mean, the number of people who've tested positive in China in the last month is basically the number that would test positive in a single testing site in Florida. So from that perspective, it's not major, but China, because of the size of its population and often the close quarters that people live in some of its cities, it is being very cautious. I think another thing that's important to note is, all these cases have been brought from the outside of China, and it sort of proves the point that no country is safe until all countries are safe. And also another important thing to mention about the Chinese outbreaks, they're still low enough that you can do contact tracing. For example, in Florida, when you have 17,000 positive cases a day, there's no way you can do contact tracing. But in the numbers in the 100s, you definitely can.
Well, you've made that very clear. Dr. Kate Tulenko, thank you very much for joining us. Thank you.
Thank you.